Hello to everyone today. My name is Nicole Sullivan. I am the Director of Financial Planning and a co-founder of Prism Planning Partners. And today I'm joined by Nate Rubenstein of Midwest Medicare Advisors. And Nate is going to be talking to us all about Medicare, how it works, and kind of what you need to know as someone who is maybe thinking about signing up for Medicare in the not too distant future.
My name's Nate Rubenstein. I'm glad to be here. And I wanted to spend a little bit of time talking about how Medicare works and the importance of annual reviews. And the goal here today is for you to leave with a better understanding of how Medicare works, as well as hopefully leave here with some tips and tricks on how to save some money and how to maximize the money that you spend on your Medicare insurance. I thought I'd start where that Medicare journey begins. For many people, it begins when you first turn 65 and you retire. And the first step in joining Medicare is enrolling in Parts A and B. And Part A is the part of Medicare that covers your hospital insurance. And so I like to think of it as if you have an inpatient stay in the hospital, your Part A is going to help cover costs associated with those services. And your Part B is going to help cover costs associated with going to the doctor's office. So when you go for your annual physical, or if you have to see a specialist, Part B of your Medicare is going to help cover costs that are associated with that. Once you're enrolled in Parts A and B, it comes to a point where you have to make a decision on where you're getting your supplemental benefits, because there's gaps within Parts A and B. And the more traditional way to get your supplemental benefits is what's referred to as original Medicare. And this is the more traditional way to get your supplemental benefits through what's called a Medicare supplement policy. It's also called Medigap. And I like calling it Medigap because that's what it does. It fills the gaps that lie within Parts A and B. And when you purchase a Medicare supplement plan, it helps pay for things like coinsurance, copays, and deductibles. And it gives you more comprehensive coverage than you would get if you just had your Parts A and B. And so there's a piece missing within Medicare supplement as well. And those are the costs associated with your prescription drugs. And that's why in 2006, the Centers for Medicare and Medicaid Services introduced Part D of Medicare. And this allows you to purchase supplemental coverage for your prescription drugs through private insurance companies that helps pay for monthly costs that are associated with the drugs that you take. The one thing about Medicare supplement that I'd like to mention is that with a Medicare supplement policy, you can see any doctor and go to any hospital in the country that accepts Medicare. There's another way to get your Medicare supplement benefits. It's often referred to as Part C. You might know it more commonly as Medicare Advantage. And the way that Medicare Advantage works, it combines Parts A and B of your Medicare insurance. And it also, most of the time, includes prescription drug coverage. And so I like to think of it as an all-in-one plan. And the big differences between Medicare Advantage and Medicare Supplement with Part D is that with Medicare Advantage, it's typically defined by either a PPO or an HMO network. And so with Medicare Advantage, you have to stay within those networks in order to receive in-network coverage. And you can't see any doctor, you can't go to any hospital that accepts Medicare. You have to utilize services within the plan service area and where they have defined the different doctors and hospitals that are within their network. The other thing that I like to mention, and one of the big differences between Medicare Supplement and Medicare Advantage, is that with a Medicare Supplement policy, you're typically going to be paying a higher monthly premium for that insurance, but you're going to pay less when you go to the doctor and hospital. You're going to pay less when you utilize the plan. The opposite is true for Medicare Advantage. With Medicare Advantage, you're going to pay a lower premium, and oftentimes there's $0 premium plans out there, which is great for people looking to save money on a monthly basis in premiums. But when you go to utilize the plan, you're going to pay more as you go. You're going to pay more out of pocket as you use that plan. And if we go to the next slide, I'd like to talk a little bit about the enrollment and election periods that coincide with Medicare. And let's start with the first one, which is the initial enrollment period. The initial enrollment period is a 7-month window. It starts 3 months before you turn 65. It includes the month you turn 65, and it runs 3 months beyond the month you turn 65. This is typically the time where people enroll in Parts A and B, and they make decisions on where they're going to get their supplemental benefits from. For example, once you're enrolled in Part B, from the date that you enroll in Part B, there's a 6-month window that's your Medicare supplement open enrollment window. And this allows you to purchase a Medicare supplement policy at guarantee acceptance. And so you don't have to go through medical underwriting to get enrolled into a Medicare supplement policy.
Right.
Oftentimes during this IEP, people choose to enroll in Medicare Advantage. And with Medicare Advantage, there's what's called a trial period. It's a 12-month period that allows you to test out a Medicare Advantage plan. And if you're not happy with it, you can come back to original Medicare and enroll in a Medicare supplement policy at a guarantee issue rate, which is really important to note. You can always try Medicare Advantage for a year and come back. The next enrollment period that I want to talk about is the special enrollment period. And an example of a special enrollment period is somebody who didn't come onto Medicare when they first turned 65. They kept working, let's say until they were 67 or 68, and they stayed on their employer plan and they decide to retire. This is a special enrollment period that allows them to come off of their group employer plan and enroll in a Medicare supplement or a Medicare Advantage plan, very similarly to how it would work in the initial enrollment period. You would be able to get into a Medicare supplement policy at guarantee issue. And there's a little bit more work that goes into enrolling into Medicare. If you're past the age of 65, there's some more forms you have to fill out. You have to work with your employer and they have to sign off on some things and validate the past insurance that you had.
Nate, can I ask one quick question before we move on?
Sure.
So you keep bringing up this term guaranteed issue, and I'm wondering just maybe for someone who's not familiar with that term, if you can explain what that means and why that's so important.
Sure. I think a perfect example of that would be somebody who's been on Medicare for a few years and they have a Medicare supplement policy, and maybe the cost of that premium is getting high to the point where they reach out to somebody like me or another agent and they want to review that to see if they can get a lower rate, which is, it's very common. It's something that people do typically once a year, every 2 years. The caveat with that is that if you're past your 6-month window to get guarantee issue into a Medicare supplement policy, you have to go through medical underwriting. And so if you have a chronic health condition, that might be reason for a carrier to deny you to be enrolled in that plan in a lower rate, right? So I think the most important thing is that, first of all, if you do have chronic issues, I always push people away from Medicare Advantage because once you have a supplement policy, they can't kick you out of it. You can get denied for making a change, but once you have it forever. And so that's why I think it's really important when you're first coming onto Medicare and you're selecting a supplement policy is to maybe not choose the carrier that has the lowest rate, but you want a carrier that has a strong track record. They've been around for a long time and they have a good history of low rate increases. So you don't have to make changes and you're not stuck with a high premium forever. Let me just touch on the AEP, which is the annual election period, because we're in it right now. It runs from October 15th for about another month here. I think that this is the most important time of year for people who are currently on Medicare. And the reason for that is because you can make changes to your plans. With Medicare Supplement, you can change your plan at any time during the year. And so the thing that I always urge my clients to focus on at this time of year is to review their Part D policies, to review their drugs. Have they been prescribed new drugs over the course of the year? This is where I see the most cost savings, is doing an analysis of the current plan you're in and then comparing it to the other plans that are out in the marketplace to make sure that you have the most competitive rates and that your drugs are covered at the highest level. I think another reason why this is super important is because Part D plans change every year. The carriers might change the formulary list, and the formulary is simply just a list of drugs at which level they're covered under. So that's changing every year. There's really no reason not to do an analysis because you can change this once a year.
Okay.
There's also a couple other things you can do. You can switch from Medicare Advantage back to original Medicare. You can switch from original Medicare to Medicare Advantage. And with all of these changes, your plans go into effect January 1st of that next year.
Great. And I'm sure everyone has seen and been bombarded with, things in the mail and ads. And I'm not even on Medicare, and I feel like there have been a ton of advertisements this time of year. So
yes,
they do a good job alerting you to open enrollment.
Lastly, I want to talk about the importance of an annual review. And I talked about it a little bit on the last slide, and the importance of reviewing your Part D plan. Just for example, I worked with a client of mine who was prescribed some new medications over the course of the year. And the plan that she was in, it was an okay plan, but we did an analysis and we found a plan that was better suited for her needs and ended up saving her $1,300 for next year. So that's not always the case. Sometimes it's just a couple $100 and maybe it doesn't make sense to make a change, but that's why it's super important to look at your Part D plan, check the formulary of the current plan you're in. The best way to do this is to go to Medicare.gov. They have an awesome tool. It's called the Medicare Plan Finder. That's what I use to help my clients. And it's just a great tool to make sure that you're in the right plan for that next year. Nicole, you were talking about a lot of the advertising that's going on and a lot of things you get in the mail. I think it's super important, whether you work with me or somebody else who's local, I think it's important to work with a local agent because they have an understanding of the marketplace and the plans that are available in your area. And if you call into an 800 number or one of the Joe Namath ads that you see on TV, you're probably getting directed to a call center who may be able to offer you plans, but they don't have the knowledge and expertise in the local marketplace. Finally, you might not have to do anything. You might go through a review and find that everything is going well and you're in the right plans and you're in the right place, and that's okay too.
Great. Talk a little bit about the costs of Medicare and getting signed up for that. So, to start off, Part A of Medicare is free for most people. Part B is something that you pay for typically out of your Social Security checks. Now, if you are opting to delay Social Security, say until age 70, but you want to hop on Medicare at age 65, you can directly pay your monthly premium with Medicare. So the standard premium, which is for individuals who have adjusted gross income under $88,000 if you're single, or $176,000 if you are married filing jointly, that is $148 a month per person. If you're, and the way that they figure out your premium is based on your adjusted gross income as of 2 years ago. So Medicare will take a look at your 2019 tax return to determine what you will pay for Medicare in 2021. If your adjusted gross income was greater than 88,000 single or 176,000 married filing jointly, you will pay a surcharge on top of that. And I don't have those figures here for purposes of this webinar, but you can certainly speak with your advisor or look online for those figures. As well, too, Part B has a deductible, which for 2021 is $203, and for Part D, that deductible is $445. Your Part B supplement, you will work with a private insurance company and pay them on a monthly basis based on the level of supplement plan that you're in. And that goes as well for your Part D monthly premium. And back to Nate's earlier point, that's why it's so important to have an agent with you, because there are definitely a lot of companies to choose from. They charge different rates, and it's important that you are working obviously with a reputable company, but also getting adequate coverage.
I just want to quickly answer a couple of questions. Mr. Weber, I'm going to have to get back to you. You had a great question on veterans and if they can receive Part D prescriptions through the VA. So let me get back to you on that one. There was another question about if you need to communicate with the current plan to stay with the plan for the next year. If you're not making changes, you don't have to do anything. The only time that you'd have to do something is if your plan was going away. This doesn't typically happen with Medicare Supplement. With Medicare Advantage, the plan might be changing or it might be going away. In that case, you would get a notification well in advance and you'd be given ample time in order to make a decision on a new plan.
Great. Great. So Nate, I wanted to, as a financial advisor, I talk with a lot of people about Medicare, and I wanted to just ask some kind of basic questions that I hear time and time again. So, the first question I get, and we kind of touched on this already, but let's say, I'm still working, I'm 65, and I'm covered by my employer's health insurance. Do I need to jump on Medicare right now?
It depends on the size of your company. So if your company has less than 20 employees, there's a rule that says that Medicare is the primary payer when you go and utilize services. And so if you work for a small business, you'd want to make sure with your employer that, whether they're under or over 20 employees, if they're under 20 employees, 99% of the time, it makes sense to get on Part A and B and then figure out what you're going to do for your supplemental benefits. If you're working for a larger employer, no, you don't have to come on to Medicare.
And another point to bring up as well, let's say, a primary earner who has the insurance turns 65 and retires and goes on Medicare. If there was, say, a spouse who is not yet 65, he or she is able to COBRA until he or she is Medicare eligible.
Right. Yep. And many people choose to stay on COBRA for as long as they can. And sometimes it makes sense to go to the individual market as well.
Yeah. Obviously, an individual circumstance, that is another reason why we would encourage you to speak with a broker who can kind of help navigate those questions. The second question I hear and see sometimes is, do I need to get a Part B or Part D supplement right now? What if I, wait a couple years and see how it goes? And I hear this question from people who are in, fantastic health. They don't take any medications. They don't go to the doctor that often. How would you respond to that, Nate?
I would say first of all, I think the most important thing is that you need to enroll in a Part D plan. You need to enroll in a prescription drug plan. Even if you're not taking any drugs, there's very low cost premium plans out there. And the reason for that is that if you don't enroll in Part D when you first become eligible, there's a late enrollment penalty. And I've seen this happen before, where people in their late 70s and even early 80s, they were healthy until they weren't. And they didn't want to pay for that premium. And now they're looking at costs of drugs that cost a lot of money. And it's almost prohibitive for them to enroll in a Part D plan because they're going to be paying, let's say, for example, and I'm just ballparking this, if you're 80 years old and you've never had a Part D plan, your penalty alone is going to be anywhere between $60 and $80 a month.
Oh my
goodness. In addition, right, and that's in addition to the premium that you would pay for your Part D plan. So I would say no matter what, enroll in a Part D plan. Do you need a supplement plan? I also think that it's super important to enroll in some sort of supplement. And with Medicare Advantage and so many plans being available at $0 premium, if you're super healthy and you hate giving the insurance company more money, which I hate too, just enroll in a $0 premium Medicare Advantage plan. That's how I would answer that question.
That's great. I think that's a great piece of advice. Here's another question that I hear time and time again. What company should I choose for my Part B supplement? I know some people think that they have had great coverage through, you name the insurance company, all these years they've been working. So can I just stay with my preferred medical insurance provider when picking my Part B supplement? Why
You know,
why not?
I think that the insurance company that you like, they might be the right plan for you. They might not be. And so when I work with my clients, it's more about looking at the most competitive rates with the most reputable carriers. And I talked about this a little bit before. I wouldn't sign up with a company that you've never heard of before, because you want to make sure that they're going to be around tomorrow. So for example, Plan G is one of the popular plans. Plan G, you're going to get the same coverage no matter which carrier that you're with. And so you want to make sure that you're with a carrier that has competitive rates, but also has a strong track record of low rate increase history.
And just to add, and please correct me if I misspeak here, Nate, but the coverages that these plan letters provide, they are mandated by law.
Yeah, and so the insurance company doesn't get to pick and choose what they cover at what level. The government mandates, hey, if it's Plan G and they get this service, this is what you're paying no matter what.
Yeah, that's a great thing to keep in mind. And that kind of dovetails as well with, how do I choose what plan letter is right for me? Obviously, we're not going to make specific recommendations here in this little webinar, but Nate, how do you go about helping people pick the right supplement plan for them?
It's obviously on an individual basis. Some people are more okay with paying more out of pocket when they use services. They're okay with having co-pays and co-insurance. And so when I meet with people, obviously, we take into account their health and financial situation. And some people come to me and say, hey, I'd rather pay less in premium and have co-pays because I'm healthy and I don't really use the plan. And so I think it's a combination of risk to what kind of benefits you're getting. So the more that you pay, typically you're going to get more coverage. The less that you pay in premium, the more you're going to have to pay out of pocket. And I like to help my clients by saying, look, I'm going to present some options to you, but you need to choose what's going to help you sleep best at night.
Yeah, that's another great question too. How might your supplements change if you are planning on moving out of state?
That's the beauty of supplement. They work everywhere.
Oh, great.
Yeah, and with Medicare Advantage, if you move, you have a new special enrollment period to get into a new plan because they're mandated by where you live, by zip code and county.
And just a final question, if someone is, going to schedule a meeting with a broker, what information do they need to have available to get signed up for Medicare?
You really don't need much. I think a lot of people start working with a broker before they even know what they're doing, before they're even enrolled in Parts A and B. I think it's important to come, prepared with, what you liked about your current insurance, your past insurance, and what you didn't like, and kind of your comfortability with how much you want to pay, in premiums, and if you're okay with paying out of pocket for costs. And I think it's super important that, if you're ready to make a decision, that you're enrolled in Parts A and B and you have that handy Medicare card.
Great. And just another question too, how frequently would you recommend that folks who maybe are 65 plus get their Medicare plans reviewed? Do they need to do this every year? Is this every couple of years? What would you say?
I would say every year, especially for Part D, because you can make changes. There's no medical underwriting. If you have health issues, you can always make changes to your Part D plan. So certainly once a year. Typically at that time, it's very easy to review your supplement plan. And people don't make changes every year. Typically, I see my clients making a change maybe every 2 or 3 years, but it's certainly something that it's worth reviewing on a yearly basis.
Definitely, and especially too if, again, a chronic condition develops or you find yourself on a more expensive drug, it certainly makes sense to have that annual conversation to just check. All right, anything else, Nate?
God, no, I think that's it. We covered a lot today. That was great.
We did. Time flies. Just want to thank everyone so much for your time today.
Thanks, everyone. Thanks, Nicole.
Take care. Bye-bye, Nate. Thanks so much.
Bye-bye.